All right, day 2 of open enrollment on Obamacare.
So many people tried to sign up on day 1. Actually, the website couldn't handle it. People repeatedly received error messages. And federal officials, they are promising that there's going to be some improvements here. They're working on all this. And our Dr. Sanjay Gupta, well, he's in Lexington, Kentucky. He's got more on how this is all being sorted out, the glitches, the health care's law impact on those who are already insured. Watch.
Susanna, Michael, glitch did seem to be the operative word yesterday. You heard about that a lot. We were in South Carolina, hundreds of people coming up to us, asking lots of questions, and we couldn't find an example of one person who had been successfully able to actually sign on to the site. Supposedly things are better today. We're here in Kentucky now, Lexington, Kentucky. We hear about 2,900 people were able to sign up yesterday, and those numbers may be improving today. An interesting sort of collision here. We heard about 3 million people signed up around, or 3 million people tried to sign up around the country, but we couldn't get an exact number of how many people were successful, in part because one of the people at the Department of Health and Human Services who was giving us this information has been furloughed as part of the government shutdown. A little bit of irony there, but it makes it harder to get that information. A lot of people asking about premiums. How much is this going to cost? It's one of the most common questions. Some of those numbers are going to come out still in the weeks and months ahead. What we're hearing for people who are joining the healthcare exchange, the marketplace, for the first time, people who have not had healthcare insurance before and are also getting subsidies, the average cost about $100 a month or even a little bit less than that. Again, 60% of people paying around that much money. But again, those numbers are a little bit of a moving target. We're going to keep an eye on them in the weeks and months to come. Another common question, how is this going to affect people who already have insurance? And you've heard many times, Susanna, Michael, that if you have insurance, don't worry about it, this doesn't affect you. Well, that may not be entirely true. For example, here in Kentucky, UPS has one of their largest distribution facilities, where UPS is actually telling spouses of their employees, spouses who can get their health care insurance elsewhere, to start doing so, because UPS is no longer going to provide that coverage for them. So you're starting to see some impact, especially on big companies, in terms of how they insure their employees. Again, a lot of moving parts. This is some of the biggest health reform in this country in nearly 50 years. So not unexpected to have some twists and tumbles along the way. As we get more information, Susanna, Michael, we'll bring it to you.